It's just a huge honor for me today to be podcast interviewing Allan Schwartz, DDS, CRNA. CRNA, which stands for Certified Registered Nurse Anesthetists. Allan is a 1980 graduate of Baylor College of Dentistry in Dallas, Texas. After dental school, he attended a General Practice Residency at the Jewish Hospital in St. Louis, Missouri, where he experienced dental OR cases delivered by Certified Registered Nurse Anesthetists. After 10 years of private practice, he said, I want to do anesthesia. So while still practicing dentistry part-time, he got his Bachelor of Science in nursing degree through the accelerated option at St. Louis University, worked in the ICU at the VA in St. Louis for a year, and then attended the Nurse Anesthesia program at Washington University in St. Louis at Barnes Hospital. You know, I'm so excited to have you on the show. We were together, what, 2 years ago at a dental convention?
We were. I was your chauffeur.
Well, you know, when you're a bald guy, they always give me a bald chauffeur. And I want to have a shout out to my my dad passed away, his brother Jerry passed away, but his little brother Mike is still alive. And Mike, I'm pretty sure, at least he believes, he was the first male nurse, RN nurse in Kansas. Did you know that? And you know why he was?
Why is that?
He graduated from when he graduated from high school in Parsons, Kansas back in the day. He was so sad because he'd never get to see my Aunt Shirley again, and she never went out with him or anything, and he was so bummed out. And then he heard that she went and applied to nursing school. So he thought, oh, damn. So he went and applied to nursing school and became a nurse, and it took him till junior year or third year of nursing school before Aunt Shirley married him. And they're still married to this day. And talk about sexism. You know, they always say how men make more money than women. And so you say, well, you know, so you look around your life, well, what evidence that do you see? When he got out of school, he was offered all the head nursing jobs at all the hospitals, and he had like a 3-point grade point average, and Shirley was straight A's, and she'd get the entry-level jobs, third shift, weekends, and but since he was a man, he got all the good job offers. So what are you passionate about today?
I am passionate about anesthesia. I love doing it. I blog on the website quite a bit on Dental Town, and I'm here to help talk about dental office emergencies with you. And
you know, it's kind of well, I want to answer this. This is Dentistry Uncensored. We don't want to talk about anything that everyone agrees on. Let's go right for the jugular.
Go for it.
Every hospital, you're in a hospital right now. You practice out of Columbia, Missouri, but right now you're in a hospital in St. Louis, Missouri. In every hospital in America, you can't be the cardiovascular surgeon and do the surgery and the anesthesia. If you're going to do prostate surgery on me, you can't do the prostate surgery and anesthesia. They separate those two skills, and the only place you see those skills combined are pretty much oral surgeons and periodontists and dentists. Do you agree with that or disagree?
It's a lot to watch, and I have seen and talked to oral surgeons about it that are doing general anesthetic, and I have to say it's tough to watch both of them, especially when you're doing a general anesthetic. If you're doing sedation, yes, it is possible to watch both. But if you're getting deeper into sedation and then general anesthesia, that is tough to watch and to be able to deal with the problems there, and then if the patient develops any problems.
And you never hear about this, that the skills should be separated until it happens to someone like Joan Rivers.
Right. Well, I mean, there it was separated. There was a separate anesthetist doing the case.
Was there with Joan Rivers?
Yes,
okay,
with hers.
I'm sorry then.
But you posted, I think it was several months ago on Dental Town, that I think it was you that said that Alberta, Canada, has finally said, we're not doing this anymore. We are separating the two. Didn't you put that out there?
Yeah, and it was a couple of years ago, it was the UK. And I was actually, Ryan and I were in London, lecturing in London and Glasgow and Paris, and the dentists were all showing me this amazing data, even though death under anesthesia is very rare. I mean, let's just say it was 1 out of a million. The UK was looking at it and saying, okay, it's 1 out of a million, but for oral surgeons and periodontists, it's like 3 out of a million. And the difference between 1 and 3 out of a million is doesn't matter until, you know, it's your granddaughter. Then you're like,
I was going to say, especially since it's you. If you're the one out of the
yeah,
three, or the
yeah.
three out of the million, or whatever, and
So
it's you.
it's easy for medical economists to say, well, this is the cost savings and this and that, and you know, and it's more efficient, faster, easier. Yeah, I get all that until it's you, and then you're
Exactly.
like, I wished I wouldn't have died under anesthesia.
Right. You have to put it to the family test or to you. Would you want that to be you on the other end of the propofol syringe?
So now you just brought up Michael Jackson. That was what he was addicted to, right? Propanol.
It was propofol. He wasn't addicted to it. He was using it because he had that new show coming out and he could not fall asleep. And he had a non-qualified anesthesia provider giving him the anesthesia. He was a cardiologist. He was using a butterfly needle in his arm as opposed to an IV catheter. There were no monitors. And apparently the guy was in the other room while the drip was dripping, and Michael obstructed. His tongue fell, it relaxed, and his chin fell, and he asphyxiated. He died while he was sleeping. He could have just tilted his chin up, and we probably wouldn't even be talking about him.
That is so sad. Me and Michael share a birthday. We're both born on August 29th. I think he was. I was born in '62. I think he was 58. Will you Google that? See what year? He was the greatest singer, songwriter, dancer of all time.
Extremely talented.
And my mom always argues with me. She what was it? Yeah, he was born in '58 on August 29th. I was 62. I mean, he's the #1 musician of all time. My mom thinks it's Frank Sinatra, and I always tell my mom, I've seen kids jamming out to Michael Jackson on boomboxes in India, China, and Brazil. I've never heard anyone listen to Frank Sinatra outside of the United States one time. I mean,
it's a different generation, Howard.
I mean, he was just a legend. So I want another controversy. So you agree that a doctor, dentist, oral surgeon, periodontist should not do their own anesthesia?
That's the way that I feel. And I do anesthesia. I am still a dentist. I'm still a licensed dentist in Missouri. And I'm one of 2 general dentists that have a deep sedation general anesthesia permit the way an oral surgeon does. And I do the anesthesia. The dentist, whoever is patient is that I come into their office, they do the surgery. So we separate it.
So you go around with your own stuff into dental offices in Columbia?
Throughout the state of Missouri. I've just got a few select offices I do, and it's not a full-time job. I just do that for the dentists that are my clients, that have patients that come up, and then we get the patient worked up medically, and then I come in with all of my equipment and supplies.
You know, people talk about how, to build your practice, you should offer, same-day dentistry or chairside milling, same-day crowns. God, half of America is afraid of the dentist. Having someone like you come in would be 10 times bigger than buying a laser. Do you agree or disagree with that?
I agree with it. I think that if we can get rid of the fear, and a lot of times I'll just have people that are just shaking in the chair, and I'll say to them, I've been doing this for a lot of years. I want you to stop what you're doing right now and let me show you. We're in the show me state, so I want to show them that we're going to get them comfortable. And they do. They'll stop. They'll relax a little bit. I said, let me get the IV in, and we're going to get you comfortable.
And what drugs are you using these days? And are they safer than when you and I got out of school back in the day?
Propofol is unbelievable. That came out in the about 1992-ish, early 1990s, and it was quite expensive. So I use propofol and ketamine, and then we rely on the local anesthesia for them to still be comfortable. But we do it after I get them off to sleep and get them really deeply sedated.
So why do you like propofol? Propofol?
That's it.
You know, the only D I ever made in my life was in Spanish, and I can still remember San Martin telling my mom that I was linguistically retarded. And then it was like a couple years for that, my mom and my 5 sisters, we all had to take piano lessons. And my mom had some fixation with the piano, and I was the only child where the teacher fired me. She told my mom, she goes, he couldn't carry a tune in a lunch pail. And but so why do you use propofol and ketamine instead of like Versed and Reversed?
Well, there's no reverse it. But the reason that I like propofol, and I was going to give you a mnemonic to remember it,
I
Howard,
thought
is
Versed had
no.
an antagonist that if you put
Oh,
someone
it
on.
does. But I mean, that was the joking name about the reversal was the flumazenil. Is
Oh,
they were
okay.
going to, they should have named it reverse it.
Okay,
You're
so
right. So I've got a mnemonic for you to remember the pronunciation. Nobody falls like propofol. How's that?
nice.
You like that?
I do. Nobody falls like propofol. Nice. Okay.
I remember when I was in dental school, I had a prosthodontist that taught us at Baylor. He said that he could make plastic walk across the street, denture plastic. Well, I feel that way with propofol since I've been using it so many years. It's real quick on and it's real quick off, but there's no reversal for it. I mean, when I say real quick, it's like within minutes, depending on how you give it. Now, we can put the patient totally to sleep with it, or we can have them just really light. But that's the art of anesthesia, is to get them to the level that you want them to be, that they need to be.
Besides anesthesia, talk about medical emergencies. What would you say is the most common medical emergency in a dental office?
Probably the most common is you're going to have these patients that are extremely fearful and they will vasovagal. They'll go hypotensive, they'll faint, in other words. So that's the one I think that you're going to treat the most or the most
Do you
frequently.
think they're fainting from fear or because they just saw the dentist and the dentist is just so hot?
It was that one, Howard.
It was that one.
When they're at your office, for sure.
Yeah,
I mean,
I'm lucky. I'm 1 mile away from the fire department, and once a decade I've had to call the fire department, and one was because my own office manager fainted.
there you go.
But
And
it's
you should be able to, that one, that would be one you should probably be able to handle. And we have algorithms that we follow and that I teach in my sedation classes. And certainly I can make those available to the listeners if you don't mind if they contact me.
how should they contact you?
They can email me at sedationconsult@outlook.com. That's our lecture company is sedationconsult.com. So I would be happy to send them. I've got dental office emergency algorithms that I follow. There's a quick and dirty emergency cheat sheet that I put together for emergency drugs in your kit. And then I've got the ADA safety checklist I'd also like to send.
And Ryan, will you also his course on Dentaltown and share that right now on? There's a link to share it on Facebook, Twitter, LinkedIn, Pinterest, and Google Plus. You also did a course for us. Do you know the most common medications found in dental emergency kits by Dr.
That's
Allan
right.
Schwartz? Prepares you and your staff on these common meds and dosages. And my gosh, it was just all the reviews on it were amazing. Thank you so
Thank
much
you.
for doing
Thank
that.
you. And we've got 4 parts, and we've still got 2 more that I'm going to write for you. So that's going to be upcoming. One of them is going to be for sure next year. We'll get you part 3 of 4.
Nice. Thank you so much for that. I'm just posting on that. I am podcasting Allan. So you said they can email you at sedationconsult@outlook.com, but you also have a website.
Right. That's the sedationconsult.com. Dental-related anesthesia lectures for sedation dentists and anybody else that's interested in the different topics we have.
So Sedation Consult, Anesthesia and Sedation Continuing Education taught by experienced dentists for dentists, dental hygienists, and dental assistants. Very nice. So what are they all going to find there? Basically what?
Well, there's a number of online courses, but then we do some live courses too, such as monitoring. We've got a big IB certification class. Now, it's different than the dentists all want IB certification. Not all, but a lot of them do. This is a requirement in Minnesota for dental assistants, and it's a great review course for hygienists and dentists. But the dental assistants are required to have, and they're allowed to put IBs in up there, but they have to have this course. It's an IB certification course.
So why do you have Dr. Ken Polk, his book, Conquering Your Adversities? We did a podcast with him. Why is he?
I know you did. He's a bud. He's going to be teaching with me. Eventually, we're going to get him worked into some of the lectures. He's a friend of mine.
He said to me, he says, why do you want to interview me? And I said, Dude, you're the only dentist on earth who not only was a quarterback in the NFL, but played for two different teams. You don't think that's the coolest damn thing? I mean,
He is such a neat guy. And like I said, we're friends. So we talked about it before he even started talking to you. So
now, did you ever ask him the politically incorrect question? Do you think does he think he suffered concussions in being a quarterback for two different NFL teams?
I'm sure he'll listen to this. So I'm going to say that I think he took a couple headshots, Howard.
Couple headshots. See, mine
I
were
think
just mine were just from drinking, but his were he had a noble reason. I think that sport is dying. I really do. You know why? Because there's NFL players that live in Ahwatukee who won't let their kids play football,
yeah.
and they say that if you go talk to the people in Phoenix, the interest in putting like flag football and all that, it's rapidly declining. So if you lose all your farm fields of flag football and all that stuff, eventually that'll affect high school, and eventually that'll affect the NFL.
But there's still going to be a group of people that want to make the big bucks that are going to play it, don't you think?
Oh yeah, but I'm just saying there'll be less. There, if you get less inputs into at the 5-6 year old level in flag football, you're gonna have less outputs
Right.
in the high school.
You're
So
right.
what do you think dentists should be doing better to prevent medical emergencies?
I think that you've got to make sure that you have got the patient tuned up and ready to go. Thorough health history. If you have any questions, get with their doc before you start doing treatment on them. Make sure that their heart, lungs, liver, kidneys, everything's in good shape. You just want a good, thorough medical history and ask them questions.
Well, 100% of the time that you go to your physician, before you even see the physician, the nurse puts you on a scale, weighs you, takes your blood pressure and your temperature, and you almost never see that in dentistry. Even when you're working, I noticed the only three publicly traded dental offices in the world, two in Australia, one 300 Smiles and what? Pacific Smiles Group. Then the other ones in Singapore, Q&M. They won't they won't allow anybody, even like you, anesthetists, to come in and do anesthesia on anyone 12 and under or 65 and over, because their Wall Street lawyers say when anything goes wrong, they're under 12 or they're over 65. And I got to ask you, how many pediatric dentists weigh the child and take the temperature and blood pressure? And then how many general dentists, if grandma and grandpa come in over 65 and they're going to give them a bunch of anesthesia and do some root canals, Crown Bridge, how many of them even take their vitals?
I would imagine, I'm not 100% in the field anymore. I think you're leading to the what you're trying to say is not a lot of them do it. Is that what you're going with it?
Absolutely. I've never seen it.
Right.
I mean, there's not one dentist listening to you right now that even has a scale in his office, but he's going to turn around and put carpules of anesthesia in some 2 and 3 year old little child and do a pulpotomy. We had a death here in Phoenix. It was about it was back in the day. It's probably 10 years ago, and he gave a little girl too much local, and she died.
Yeah.
And there was no one knew her weight. And then it turned into crazy trouble because then he tried to alter the charts.
Oh boy,
and that
can't do that.
That turned out to be more of a legal crime than overdosing a child who resulted in death.
Right, you're just masking, and you're just telling everybody you're guilty.
Yeah,
I meant to tell you too. I have an Arizona connection. We moved to Phoenix when I was a teenager, 17 years old, from Minneapolis. So I went to Arizona State. I know Ahwatukee when that was just dirt over there, and that sort of used to live up in Sunny Slope in North Phoenix.
Wow, my God! You should have just bought 1 acre of land in Ahwatukee and then went and worked at Taco Bell, and then you would have been a multimillionaire. Oh, so do you recommend weight and vitals on your? I mean, do you do that? I mean, what do you recommend when on your health history?
I do. I do. I have the fill in the blank things. So we need to do that. Now, do I weigh them? If it's a child, yes. If it's an adult, I ask them their weight, and they get me pretty close. And I say, if you're fibbing on your weight, then I'm not going to be able to give you enough medicine. And then they'll fess up and tell me what their really true weight is. Because a lot of it is based on dosage based on their weight.
Well, boys don't lie on age or weight. Only women do. They always lie on their age and their weight. So,
There you go.
what is the average woman when you tell her to fess up? What is the average spread between what she said the first time and the second time?
I think you got a couple of 20, 30 pounds there of
Yeah.
fudge factor. You know what I'm saying?
Yeah. Yeah, that's like online dating, I remember I did that back in 2005, and oh my God, every single one time you showed up, the picture was, 10 years old, and it's like you're almost shocked. So, you talk about the 12 most common medical emergencies in the dental office. You want to go through those?
Sure. Um, Give me just a second because I want to make sure I don't forget any of these puppies.
And 12 is so interesting. The numbers 10 and 12 are very interesting. 12 is so interesting because that was the 12, what is the astrological signs? The zodiac, and then that turned into the 12 months of the calendar, then that turned into the 12 apostles. And is that why you picked 12? Because
No,
humans just love the number 12?
I didn't. What I did is when I was researching this, I went to a number of textbooks, especially emergency room textbooks, and these were the ones that stuck out in my mind, the ones that I saw the most common since I've been doing anesthesia for the last 23 years. So these are the ones that I picked out. Fortunately, some of them are extremely rare, Howard. We don't ever want to see them, but hypotension is probably, like I said, the most common. I
That's
put the
fainting.
first, right, exactly, drop in blood pressure. I put the general emergency response protocol. It reminds me to tell everybody you don't always call 911 for every emergency in your dental office. Some of it you should be able to handle, and some of it you do have to handle quickly. Like number 3 is laryngospasm. We've got to, if somebody starts choking, we've got to make sure we're able to clear that and they're going to start breathing again.
What was number 2?
2 is hypotension.
What was 1?
1 was general emergency response protocol.
Okay.
3 is laryngospasm. 4 is acute airway obstruction. Man, we don't want to see that. Cardiopulmonary arrest, where we have to start CPR and ACLS. Number 6 is acute allergic response to drugs. 7 is angina pectoris, possible MI, myocardial infarction. Emesis and aspiration of vomitus is number 8. Convulsions and seizures is number 9. 10 is oversedation. That's one of the ones you said you liked, that caught your eye. Hypoglycemia is number 11, and then asthma, bronchospasm is number 12.
Gosh, man, every one of these things you said just brought back a nightmare. You should call that your stress list.
Yeah, really. There's a
Like,
couple in there I'd like to take off the list that I never want to see in real life. The cardiopulmonary arrest type thing and the acute allergic response to drugs. Those are pretty bad.
what is the drug usually?
For the acute allergic
Yeah,
reactions,
yeah.
it's going to be an antibiotic probably most of the time for the stuff that we would give in a dental office. I rarely have ever heard of a lidocaine, fentanyl, or Versed allergy response, or even ketamine for that matter.
So, what emergency equipment do you think you should have on hand? What's
Well, all right, go ahead.
and then it gets into the legal deal of what do you think they should have, and then what do you think they legally have to have?
I would tell people look at your dental board rules. They're going to tell you what you need to have in your office, especially if you're doing sedation in the office. There's a list of things that I had to buy when I set up my anesthesia practice. So, probably the most common, and we don't think of it this way, but drug is going to be oxygen. It's one of the first things I throw on the patient. And I don't mean to use the word throw, but you know what I'm saying. so that they've got oxygen going to all their tissues and especially their brain.
Does that have to be positive pressure oxygen? This isn't the nitrous oxide oxygen.
No, it can be that.
It
You
can be
should
that?
still have positive pressure available, though, but if they're breathing spontaneously, let them move air. They're going to be the most efficient.
Okay. So oxygen would be the main thing. What would be next?
If I were to look at the next most common drug, it's going to depend on the emergency. If it's hypotension and they've got an IV, and I'm going to crank the fluid up. There's a couple of other drugs that I would consider giving at that point, but how many of our dentists are going to have an IV in the patient?
I never have started an IV. I mean, I did in school when we had to, but I was scared of that from day one, and I think it's I just think it's frightening how many dentists go to the Holiday Inn and take some sedation course, and the next thing you know, that they're talking about sedation. And then, when you're a journalist in dentistry, I mean, I've had a magazine since 1994 that's gone to all the general dentists and 10,000 orthodontists. These medical malpractice people would always send me, their cases for like the last month. And they would do it because they wanted to get the word out, because they want to collect premiums. They don't want to pay claims. And the thing I noticed from reading those claims, that whenever it was over $1 million or $2 million or $3 million, they all had one thing in common. They had an IV in their arm. And then when that dentist gets put on the witness stand and they bring in somebody like you who's done this for 23 years, that dentist trained in a Holiday Inn doesn't look very smart to the jury. Do you agree or disagree?
I agree. I think that you really need to have good training, and you need to be able to follow up with somebody that you can ask questions to. I've had students that I've trained that have been more than the Holiday Inn that I've taught IV sedation to. And it is teachable. I mean, I learned it. Anybody that does it has learned it from somebody. But you've got to be able to choose your patients properly, know how to handle the emergencies, and know when to say when. Like Clint Eastwood said, you have to know your limitations. A man has to know his limitations.
But dentistry's going in the wrong direction. I mean, in 1900, there were no specialties, and healthcare was only 1% of the economy. By 2000, it was 14% of the economy, with 58 specialties with the MDs and 9 with the dentist. And these dentists will say to me, well, I'm going to learn IV sedation. I'm like, well, dude, just learning that. I mean, that is so much. And then you just said to me earlier, and you're also going to learn how to place implants, and which is so much. And then you're going to a sleep apnea course, and then you're going to go learn Invisalign. It's like, or do you really think 1900 is the business model where there's this super Batman Walmart dentist that can do endo, perio, anesthesia? So I always tell these young dentists, when you say you're going to learn IV sedation, what are you going to give up? They never, ever, ever say they're going to give up anything. They just, because how many hours would it take to totally master before you could start before I'd let you start an IV in my arm or my granddaughter Taylor's arm and start putting Propanol in her?
Right. Well, the ADA, came out in October, of last year and said that you need 60 hours of didactic and 20 individual cases that you run. So that is our dental association telling us that's the number. So I think you should have definitely more experience than that, Howard. Every case I do, I'm still very careful of the powerful tools I've got, and I recognize that they're pretty powerful. I don't take them for granted.
Ahwatukee, where I live, only has one oral surgeon. He's an amazing man. He's a legend. Greg Edmonds. He was one of the first oral surgeons I know. I mean, this is back in the day, over a decade ago, where he actually brought in a full-time anesthesiologist. And he said that not only should oral surgeons not do it themselves, for a practice manager reason, a dentist doesn't do these cleanings. He loves the fact he actually does more cases in a day than an average oral surgeon, because when he goes in there, all he has to do is pull out 4 wisdom teeth and he's gone. So it's for me, from a practice management point of view, you should be a conductor. And the conductor isn't going to go learn the organ and the piano and the drums and the clarinet. she finds amazing people to do that for her, and she just conducts the orchestra. I just think from an economic, legal, everything, it makes sense. Just have someone like you come in. I don't see how in the world it makes any sense for a dentist to commit to learning all this and doing it himself.
Let me just throw this out to you. You know that anesthesia is a continuum. We go from a level of minimal sedation to a level of general anesthesia. If you look on the website, the first picture on the sedationsconsult.com website shows that continuum. A person can still maintain somebody in one of the smaller levels, if you will, or not as deep levels, and still be safe. You're talking about deep sedation and general anesthesia, and I
Correct.
agree with you there. But somebody can still maintain somebody in the minimal to moderate range, and it's been done, and it's been done safely.
Yeah,
So
that's a good point.
You can't blanket it.
I was totally just ranting on general sedation.
Right.
Yeah.
And you're talking about, take a look at that continuum and see how that line can very quickly go from the left to the right. Like I said, through minimal sedation, moderate, deep sedation, and then into general anesthesia. Deep sedation and general anesthesia take a lot of attention and a lot of skill to maintain. And I'm not saying that the other levels don't, but it's still safe for someone to hold somebody there. I mean, you could take a Valium the night before and put somebody on nitrous and take them to a moderate level of sedation, and those are both pretty darn safe.
Is that your oral medication drug of choice, just plain old Valium, or do you like some of those shorter acting?
I don't use it. I use all IV, so I'm not a good answerer for that question. I am a Versed, propofol, ketamine. You know, we get into the deeper sedation and the general anesthesia drugs.
Right. How do you like to prepare your staff for medical emergencies?
We have to train them. In Missouri, they're required to have that training every 5 years. There's a monitoring course that we put together, but that is available for them to train staff. And it goes over very well. We have that online available also if somebody's interested. But you have got to talk about monitoring, and you've got to talk about emergencies and actually go through them, and so that people are clear, and then they can refer back to those references that I told you, those things that we can email.
Yeah, I wonder how many dentists have even read their state's boards. I mean, there's a thread on Dental Town because I guess the orthodontists are starting to sue smilesdirectclub.com. And Smiles Direct Club is, where they mail you impressions to your house. You take an impression, and then they make you the Invisalign aligner, so you don't have to see that middleman called the orthodontist. It's amazing. I think the Orthodontic Association, the American Orthodontic Association, is sued for 39 states. But it's amazing how many people on Dental Town are even posting on a thread like, I've never even gotten to my state's website, and everybody's looking. They've sued them in 36 states, but everybody's looking at their state boards, and there's a lot of stuff there that most dentists listening to us right now have never even gone to their state board of dental examiners website and looked at all their rules and regulations.
You have got to do that. It's imperative that you do that. Just yesterday, I got a call about our monitoring course that's coming up here in St. Louis from a dentist in Illinois. And I said, I hate interpreting your guys' rules for you. I know Missouri, but I don't know Illinois. And I ask you to look at it to see if the course would be something that's required. But what I'm trying to say is that you've got to know that. In Missouri, you talked about what drug can you give if they faint. We're required to use or to have available smelling salts, believe it or not, the ammonia capsules. And it's in our rule. So do I carry them? Yes. Is it something that I would use in the OR or in the operatory for a sedated patient to wake them up from hypotension? No. But I'm required to carry it, and I've got it. There's better and different things that we use. And you would never know that unless you read your rule.
Most dentists only deal with their state board one time, and that's when they go get their license. They go down there, and that's probably the only time they physically walk in there. They sign their form, they get their license, and they don't stay up on the rules. And now they've been practicing 10, 20, 30, 40 years, and they don't know all these changes. And a lot of these young kids, a lot of them just don't know that some things are even worse than other things, like patient abandonment. That's one thing when a dentist will start going under and just say, screw it, I'm just going to close my doors. I'm going to do a bankruptcy. I'm walking away from this. And then he walks to the airport, gets on Southwest Airlines, and flies back to mom and dad's house. And he's got patients running around with temporaries on their teeth. I mean, that's a huge legal crime. I mean, so yeah, there's and it looks like on these it's to be determined. I mean, can I really just send you an Amazon box with impression material, and you bite into a wafer and send it back, and then I make Invisalign trays and I do ortho on Allan Schwartz while I'm in Phoenix and you're in Missouri? I mean, that's what's going down right now. Do you think that's legal?
Boy, that just seems pretty hokey. I want somebody there that sees me, and takes care of me, that they've actually looked at the tissue. And I mean, it's your body. So why would you do that?
Well, I was, the courts have been in favor of the consumer usually. I mean, there was, remember that bleaching case where the state did a cease and desist that they couldn't do bleaching in the malls? And the company sued, and that went all the way to the Supreme Court. And they said these state boards act more as a lobbying group for their members than they do for the consumers. And they tell everybody they're there to protect the consumers, but we think they're there to protect their incomes. And, they're the judge, the jury, and executioner. They have to license the dental schools, the applicant. They control supply and demand. And they said you can, in fact, do bleaching at a mall. So I think this one will be interesting. I obviously know what all my homies are going to say on Dental Town. I know everybody on Ortho Town is going to say, it's totally illegal, but I don't know. I mean, they'll have the burden of proof because ortho's $6,000. Not every American's got $6,000, so they'll have to stand in front of a judge and a jury and explain to them what could go wrong doing Invisalign through the United States Mail Department, and that'll be interesting. I mean, do you think they can prove that a lot can go wrong, so much so that they shouldn't be able to do it, and you have to have an orthodontist watching it?
Boy, I don't know. All I know is that I want to have the best, so I'm not gonna, I don't want somebody just mail ordering whatever. I want somebody that's taken a proper impression and has worked the case up properly. I just don't want them to cut corners. It's my teeth. I just want it done right. I was going to tell you, since you were talking about the dental boards, if people Google licensing board cartels, I don't know if you've ever seen that article, but take a look at that.
Can you send me that?
There's a tremendous article on exactly what you're talking about, where dentists and interested parties are running the dental boards, and how it's really kind of a cartel.
Right. And Ryan, try to find that quote. Say it again so Ryan can hear. Or can you hear him? What's the name of it? Licensing?
It's in licensing board cartels. Just do that in the Google words, and you'll see a PDF come up of an article on that. It's really interesting.
And I'll try to find the quote. What did Adam Smith say? He said, whenever two or more men are gather, they're conspiring against the masses, or something like that. Can you find that quote, Ryan? Yeah, but basically Adam Smith, which was that was an exciting year in the world. It was 1776, and two different 32-year-old Scots published the most profound papers in the world. One was Adam Smith, which was the first economic treatise, free markets, and the other one was who wrote the Declaration of Independence. Who's credited that? Thomas Jefferson. So here's two 32-year-old Scots. One's writing on free markets out of Scotland, and one's writing on free people out of America. And that's what America was. It was really the first time that free people collided with free markets, and it was beyond a economic explosion, so much so that half a millennium later, Americans are only 325 million out of 7.5 billion. They're only 5% of the planet, and they got a quarter of all the money. And now you're just watching that whole thing be ruined because you ask anybody from Adam Smith to Thomas Jefferson, what was the greatest thing about America? They said everybody coming to this free country with free markets. And then in 1912, because of the labor unions, they shut down Ellis Island and started unions. And we've been declining ever since. And it's so funny because you'll never find a single American economist, businessman ever that thought immigration to the United States from 1500 to 1900, that was the only secret sauce that made America. I mean, if that would have not happened, we'd have been no different than Venezuela or, or Peru. And then you say, well, don't you think we should go back to that and go back to Ellis Island and just let unmitigated free immigration for all these people to come here? Oh, no, it's a bad idea now. And we need a state dental board to not let them do bleaching in the malls and not let them do, gosh darn Invisalign without having to go through it's all cartels. And
Right.
and when people say they want to fix America, my God, you don't need a new idea. Just go back and look what America did in the 1700s, 1800s, 1900s, and go back to that. You know what I mean? And
So
so,
interesting. It's
yeah.
so interesting.
I mean, my God, they talk about all these jobs going to call centers in India. Well, nobody wants to use a call center in India. Just that those people over there that would work for that wage can't move here. You look at all these big companies and they're outsourcing their program to India. They don't want to outsource their program to India. They just don't have any programmers in America. You know what I mean? They need
Right.
and if you tore down and went back to the Ellis Island days, those Indian programmers and call center people would be moving here in droves, and this economy would just be screaming again. But don't get me started. You talk about
You
dental.
started. You already started.
No, you started with the cartel. You start when you said cartels. Because I think that's what America's turned into, just this cartel. I mean, you talk about Russia's oligarchs. Well, America, everything you do in D.C. is just to protect about 1,800 billionaires. I mean, So, but you talk a lot about algorithms. First of all, what the hell's an algorithm, and why does it interest you?
An algorithm, I don't know the exact definition, but it would be a series of steps that you would take to take care of a problem. The ACLS people, when we learned that, the American Heart Association, you follow basic recipe. Of course, you can deviate from that, but at least you've got something in your brain that you can follow that will get you started. It's going to depend on how the patient responds. If the patient woke up when you were doing chest compressions for CPR, certainly you don't keep going, and they start talking to you or whatever. It's just a basic steps that you follow especially it's so hard to think during an emergency.
Interesting. Interesting. And who do you think in the dental office should be trained for medical emergencies? Is this a dentist thing, or would you train the assistant, the hygienist? What about the receptionist, treatment coordinator?
Everybody, everybody's involved. Everybody can talk and give input. We need somebody to call 911. We need somebody to run down to outside the office and flag 911, the rescue paramedics in. Everybody's involved. Someone might be really good at starting IVs. Again, we're on that, but I'm just saying. Someone might be very good at the chest compressions. Somebody's good at just all the different tasks there are to do.
And I think another bias that dentists don't realize, they always think it's a patient that they're working on because that's how humans think. They always think of it from their perspective, but sometimes it's someone in the waiting room. Sometimes, like I've called the fire department 911 3 times, once a decade for 3 decades, and one of those 3 was for my office manager. I was working on a patient. I heard a thump, and I'm like, "What the hell was that?" And it was her head hitting the carpet. I mean, it was just,
It's
and so it's not. So that's why the whole office should have to be trained, because you might be back in your room doing a root canal, and your staff member up front or a patient in the waiting room has a problem.
And who's to say that you're at an Arizona State game over at watching football in Sun Devil Stadium and you could be involved with something that you witnessed there to help that person? We're more than just drillers on teeth and fillers and all that sort of thing. We should be more inclined to help with taking care of the whole patient. And that's why I think we should know how to handle emergencies.
Yeah, and you got to be careful. I did. I got too over involved in a medical emergency one time, and it was the most embarrassing thing I ever did. I was driving home from work. This was back in the 80s. And I glanced over, and it looked like this woman was over a man. And so I pulled over. You know, I just had a quick glance. I pulled over. I looked out. I got out of my car. I ran out of the car. She was looking at her golf bag.
I thought you were going to say something else.
Oh my God! But that flash while I was driving, I thought it was for some reason I thought it was a human, and I assumed it was her husband. But she looked stressed, and I just instantly thought medical emergency. And
Wow.
it's pretty
Well,
embarrassing
good.
when you're running up to a grandma and she's looking at you. You're about to do CPR on her golf bag. That was one of the more stupidest moments I've ever had. But so what else do you think my homies should know about your website, sedationconsult.com?
Well, I'd like you guys or people out there to know that we offer a lot of courses. A lot of them are online. We just put one on there that I posted this week on herbals and anesthesia, and it could apply to herbal medications that patients are taking in dentistry. But we've got a lot of things. If anybody's wanting to take ECLS, I've got a preparatory class for that. We've got on how to read EKG for dentists. I'm a dentist, so I get it that we need to learn how to do that sort of thing if you're taking ACLS. There's just a number of courses, and they all have ADA CERP credit. So you're able to actually use that towards your license for the CE credits you need.
So how much are these courses?
They're varied. I am fair, I believe, in the prices. They're going to vary anywhere from $75 to $125, just depending on how many hours you get. And that includes the certificate. A lot of them require online testing, and we have an online testing service. We're actually able to do that live through Skype, the way that you and I are talking. The dental boards love that because that way we're able to have you tuck your notes away and take a test.
Wow, that is amazing. And these these young dentists, that they always say one thing and then they act another. A fool and their money always part. And they come out of school and they cry that they're $350,000 in student loans, and then to learn this little bitty amount of information, they're always getting in an airplane, flying across the country, dropping $500 in airfare and dropping $1,500 on a course and all that stuff. And you're like, dude, you could have learned that online for $75 at sedationconsult.com. Why do you always have to get in an airplane and fly across the country? And every time, they just had the ADA meeting in Atlanta. And what does everybody talk about? What's the biggest news coming out of the ADA Atlanta? That the number of dentists showing up, it just gets less and less and less and less. I mean, all the vendors were screaming. That they were all posting on social media, look at these aisles are empty. Well, where are they going? They're going online. I mean,
Right.
why do you have to fly to Atlanta, Georgia to learn about a root canal? I love these courses. Anesthesia and slimy green saliva, essentials of intravenous fluid, essentials of sedation, pharmacological aspects, essentials of EKG for dentists, essentials of monitoring for sedation dentistry, emergency medicine every dentist should know, 16 tough patients, an in-depth look at 16 tough patients, dental office medical emergencies adult version. Now, is that rated R? It's adult version?
I never thought of that.
Or is
That
it
could
rated
be-
X?
That could be a marketing tool.
Essentials, yeah, if you want to see the greatest adult movie ever put online, click here. Yeah, they call that, what do they call that, clickbait? You won't believe this adult online video I just watched. You should post that. That'd be perfect clickbait.
There you go.
Essentials of nitrous oxide. I love nitrous oxide. I really do. And sometimes I even share it with my patients.
And a lot of these courses
You didn't
we
catch
offer
my joke.
Yeah, I love it.
Oh.
I love it. You
Okay.
share with your patients. Here's some
I
for
said I
me and
love
some
nit-
for
that's
you.
what I always tell
Yeah.
my patients. They go, "Well, do you like nitrous?" I said, "I love nitrous. In fact, sometimes I even share it with my patients."
Love it.
Oh,
I love
and
it.
Ryan found that Adam Smith quote. People of the same trade seldom meet together, even for merriment and diversion, but the conversation ends in a conspiracy against the public or in some contrivance to raise prices. That's exactly what's going down. People of the same trade seldom meet together, even for merriment and diversions, but the conversion ends in a conspiracy against the public or in some contrivance to raise prices. Ryan and me and Greg and Ryan went with me when I lectured in, where was it in Scotland? Glasgow. And I actually got to see his statue there. I mean, Adam Smith and Thomas Jefferson, two of the greatest men that ever lived, just amazing people. And what's so funny is everything they always tell you about Scottish people, it's all true. They say that copper wire was invented when two Scots were fighting over a penny. The dentist in Scotland, is, they have more control over their overhead. They penny pinch on supply. I mean, I've never seen a culture. Ryan and I lecture in 5 continents last year. I've never seen it's the whole country is penny pinchers. And every dentist, there's dentists there. Like in America, you say, "What are your supply costs?" Whatever number he tells you is not even right. He might, I don't know, 4, 5, 6%. You're at lunch with 4 dentists in Scotland, and one will say, "Well, mine is 4.8," and the other one will say, "Well, mine is 4.2. I took it from 4.8 to 4.5 just by." They know the prices of all their supplies. It's just a whole culture that the easiest dollar earned is $1 in expenses saved. So it does not surprise me at all that that's where Adam Smith came from. It's a culture obsessed with cutting costs and saving money. There's no one cheaper than a Scot. And they don't, and when you tell them that, they don't even think that's an insult. They think that's a compliment, because they'll say a fool and their money always part, and rich people have money because they don't part with it.
Excellent. Can you tie in the drinking of scotch or the invention of scotch with any of the things that you just said? Because that is a good beverage.
Well, actually, that's a great segue question. A lot of these young dentists, when they get out of school, they don't realize a lot of their patients are self-anesthesia, doing their own self-medication.
That's true.
And they're coming in. I remember when I was young, and I just got out of school, I kept smelling like ketones or something. And I thought maybe they had kidney problems, and I would ask them, and I said, "Well, your breath smells like ketones." And it took I think I had this lecture with 10 or 15 patients before some old guy said, "Dude, I don't know what the hell a ketone is, but I did have a couple of belts of whiskey before I have to have a couple of belts of." And when he said that, it was just pie in my face, that's what I'm smelling. What percent? And I think it's very common in older men. You get grandpa in there, he's far less likely to say, "Alan, I'm afraid of the dentist. I'm scared." He ain't going to do that. But what's he going to do? He's going to drink a big old belt of whiskey before he walks in there. And now we're seeing the legalization of medical marijuana. So people are eating edibles before they go in there. What should a dentist be thinking about if his patient's pre-medicating fear and drinking whiskey and eating marijuana edibles?
That is where that pre-op evaluation comes in. I do a pre-op assessment on every patient. There's a form I fill out and things like this. And if I suspect anything, I ask them directly, what is going on here? Because we can't have sedation medications and alcohol. As far as marijuana goes, it's so new. I don't even know what these patients, other than if they're really inebriated, what they're going to show. But they've started the sedation process for me. And remember, I said I haven't really said, I can titrate my drugs and I can give them what they need to get them through. So it's going to depend on a patient-by-patient basis, Howard.
Right. That's all. They just summarize all of healthcare. It's an individual case. They just put in the first medical marijuana dispensary in our town, Ahwatukee. What's it called? Sunflower Medical Marijuana Dispensary. It was about a year ago. So I went in there. I just wanted, I was thinking, is it going to look like a deli and these chocolates and edibles? I didn't buy anything, obviously, but I went in there. And you know what blew my mind? Number one, it's right next to a dental office. And the dental office has never seen that. It was in a medical dental professional plaza. Oh, my God. He's like, this is great. There's so much traffic now. It used to be, all the other people, oral surgeons and whatever. But what was amazing, what I didn't see coming, was that thing was built to be ambushed with an AK-47. Nobody will use their credit card at a medical marijuana shop. So it's all cash, and I was talking to the manager, and he has to have a money truck come every single day. It's that much cash. And looking on the counters there, I mean, I've never seen that much cash in my life. I mean, you go to a bank, it's in like the drawer, it's in, it's tucked away or whatever right there. I mean, this was just you're talking through bulletproof glass, and the windows are caged, and because they don't want some rival gang, they tried to actually come into my center, or not my center, but where I own my land and building in the Safeway, Chase Bank, this 20-acre plaza. They tried to go in there, and the landlord had the space to rent them, and he wouldn't rent them to him. And I was talking to him. I said, "How come you wouldn't rent to him?" And he says, "Because I'm looking at the mortality rates of retail centers in California, and the only thing that causes mortality is when you put in a medical marijuana deal, and then a local gang will come in there and take it out." And he was showing a lot of the tenants and landlords these murder rates, and he goes, "We don't want that kind of trouble." And then it didn't register. I looked at it, I thought it was interesting. But then a year later, it goes across the street from me. So I thought, I was with a couple of my boys, I said, "Well, let's just stop in and check it out, because, maybe you'll get the owner will be a new patient or something." And, I'm always out there pressing the flesh, running for mayor. And, oh my God, you couldn't have robbed that place if you and your 5 best drinking buddies all had an AK-47.
Wow.
They are prepared.
That's scary.
For war.
Wow. That is really something.
Yeah, amazing. Well, Allan, that was the fastest hour I've done. Did I forget anything?
I just wanted to touch on one thing. If they do take courses with us, which I really hope people will get interested in, you've got access to me, not only to talk to on the phone, but to email. So I'm there to back up what you're learning if you have any questions or anything like that. I just wanted to add that.
Well, you're a great guy. That's that old Midwestern Missouri values.
You went to school out here, you know it.
I know. I grew up in Kansas, Wichita, Kansas. Went to undergrad at Creighton in Omaha. Went to dental school in Kansas City, and now I live out here. And I'll tell you what, those Midwest values. We were talking about Scottish values. Those Midwest values. They just, one of the reasons they have so many fewer problems because them people were just born to work. They're just not afraid of work. And then you go to some of these bigger, fancier cities, and a lot of people, they spend half their life trying to avoid work. And, there's just nothing like good old homework. You being transparent, you letting your customers call you, Skype you. You're a hell of a guy, Allan. But I just want to thank you so much for taking an hour out of your life and spending it today with my homies. Thank you very much, Allan.
I thank you too. And since you said you never started an IV on anybody, I got to get you trained. We'll have to have you do it on some of the practice arms we've got. I'll teach you how to do it, Howard.
Practice arms? I'll just bring my monkey Ryan. I only wanted 2 boys, and he was the third. So Zach and Ryan are just extras. Ryan, can I use you as a primate research IV monkey? What could go wrong, right?
Have him start lifting weights and drink lots of fluid, Howard.
Okay, buddy. Thank you.
All right.
Thank you so much.
I enjoyed the heck out of it. Thank you.